Pro-Act 2015 is an European Commission-founded project through Welthungerhilfe, a German international non-governmental organization supporting Sierra Leonean farmers to improve on the cocoa, coffee and cashew value chain in the eastern and northern part of the country. In Kailahun District, Eastern Sierra Leone, the European Commission, in partnership with Welthungerhilfe Sierra Leone, is supporting government efforts to reach out to 10,000 households in cocoa and coffee farming communities within Guinea to Liberia borders, conveying the message of hand washing, social distancing and stay home and use face masks to mitigate the spread of the coronavirus in Sierra Leone.
I have started, together with my Chiefdom authorities, we have started sensitizing our people in the upper Bambara Chiefdom. They are really complying. We have got some assistance from some organizations, and this morning I have just received a team from WHH and EU who have come. They've come with some sanitizers or soap and some instruments to ensure that our people actually keep to the rules and regulations. For instance, distancing themselves, washing their hands. You can wash your hands as much as you can, especially the palm, because most times when you feel some scratch in your eye, you use the palm. But we have told them, don't use the palm of your hand to scratch your hand. You can use the elbow, this part of your hand, to scratch your hair or your eye or any part of your body that is itching. And therefore, I want to actually appreciate the presence of WHH and EU. We are praying that this coronavirus will be put to our back very soon, as we did during the Ebola outbreak. The paramount chiefs in Kailahun District, who were the first people to come out with rules and regulations to prevent Ebola. So we are using those same rules and regulations, and that is what we are telling our people. Washing of hands, distancing ourselves, not crowding, more than 10 people crowding together. There are a lot of activities we are supposed to undertake this period, but we have suspended all that until we put coronavirus behind our back.
My name is Dr. Desmond Mada Kangbai. I'm the District Medical Officer for Kailahun District, Ministry of Health and Sanitation. Well, since January, we have been involved in a lot of community sensitization and engagement. We started with radio programs initially in January, when the outbreak was more in Wuhan, in China, where we are going over the radio sensitizing people about the signs and symptoms of coronavirus, the presentation, and also we had several trainings of our PHU, Peripheral Health Unit staff. We trained them also on the case detection and the clinical presentation of coronavirus. And also, we moved all across, because in Kailahun we have 15 chiefdoms, and there are 8 chiefdoms that have border with international, with Guinea or Liberia. So Kailahun is unique in that we share border with both Liberia and Guinea. And by doing so, and in Kailahun also, the Ebola started here. The first case that came from Guinea, Gegedu, came through Kailahun. The civil also started from Kailahun, and especially from this point where we are, Bomaru. So we focused on our border points to make sure we sensitize people and put structures in place so that Kailahun won't be the entrance of COVID-19 to Sierra Leone.
Our focus is on hand washing. We encourage that the soap is used for hand washing as many times as possible, as already mentioned by the Paramount Chief, who is also a member of Parliament. And apart from that, apart from the washing of the hands, the hand hygiene, and also the use of masks, as you can see in public, we are also encouraging proper nutrition, good nutrition, have a balanced diet to be able to ensure that your immune system is strong enough. COVID-19, as compared to Ebola, COVID-19 is easily spread, easily communicable. We also need to dispel the myths that are working on the assumption that COVID-19 is only a European disease, or only a Chinese disease, or only an American disease, or an Asian disease. This is a disease that humanity is at risk. All humanity. Doesn't matter the race, doesn't matter the color, doesn't matter the nationality, doesn't matter the age. Both young and old Africans, Europeans, Asians, and any other race that you may mention are all at risk of this disease. We therefore encourage proper hand hygiene, proper nutrition, reduce the number of times you touch your face or completely avoid touching your face, and wear masks to protect yourself in the public or from the public in case you're infected. We look forward to moving across, especially Kono and Kailahun border communities, to send this message and hope that it will cascade downwards to the entire country. Our approach for soap distribution is from house to house, and our focus in Kailahun is 10,000 households, and in Kono is 10,000 households. So we move from house to house at the borderline communities to ensure that we sensitize at a personal level. Then we are also focused on distributing also in the borderline health centers that are deprived, borderline security posts also, to encourage the cascading of this information.
This WHH and EU and then they can our village, so that they can supply we soap and bucket for wash hand. So this sickness they want for low can together for low fight this sickness we don't can na salon. So they can supply we soap for wash hand any sao come for wash hand. If you want, let the sickness done inside salon, let done inside this country, the whole country, they let done inside the whole country then. Lord keep on washing hand. Lord no go inside crowd, they will go park there, no one crowd. Lord no see people then they pass. We go say, did you my family, you back to my family, we go shake hand me and you say you do my own brother. So we go shake hand, Lord not do that. Me the advice what I get for my family there, now in this.
My name is Sakila. Usa ade na kundu chesho. Ude near border Guinea and Liberia. Trade seven winko na meeting wema then go tell we for us. Say no we go dey wash with hand with soap. We say sit down, let clean. Then tell we. And so they do. This sick time make we dey wash with hand because we no answer again. Because na Ebola na ebike. So this sick you, we don't want to na again. Now you make we dey wash with hand with soap.